Go HD, the local news leader. This is Channel 13 News at 4.
We're shutting a lot of state facilities down here in Iowa. And where do they go? Where do they go?
It's the question of what now? The state has already shut down 2 of its mental health institutes. Critics say Iowans are suffering. The Branstad and Reynolds administration say those institutes were outdated and private and nonprofit sectors could do better. The prison system is waiting for proof.
They don't belong in a jail. But there's no other place for them. I mean, and they will sit in our jail until a bed in Cherokee opens up or Independence.
Schools, hospitals, and families all feel the strain when your child, classmate, neighbor, friend, or coworker needs help and you don't know where to turn.
Like, is this what we're willing to accept here in Iowa? Is this the level of help that we think is okay?
Good afternoon, I'm Dave Price. We join you live from Iowa Methodist today, part of the Unity Health Des Moines system. 600,000 people in our state are living with some kind of mental illness. So how do we care for them? That's what we're going to explore in this town hall for the next hour as we search for answers. You can share your stories from home through social media with the hashtag #MentalState. Now, during this town hall event today, healthcare professionals and advocates will reveal where the system is failing Iowans now. State leaders will weigh in with some possible solutions, and families share the devastating consequences of not being able to find care.
That smile. Mary Neubauer marveled at little Sergei's smile. She knew this orphan in Russia should one day become her son in Iowa.
We saw this one little boy, and he was just so gregarious, and he was taking care of all the other kids around him.
But through the years, Sergei's smile would try to hide so much pain.
Later, it became obvious that he had PTSD, depression, anxiety, and it was getting more severe as he was getting older.
His parents frantically searched for help in Iowa and beyond, but how to help, where to find it? Those answers seemed impossible to find.
Here in Iowa, in terms of long-term residential care, which is what Sergei did need if he was ever going to have a chance to get better, there just isn't any.
Just days before his 19th birthday, unable to quiet the demons inside him, Sergei took his own life. Sergei's parents remain committed to him. That boy they first met in Russia who was so determined to help others, they think his legacy remains to keep helping others. They will not accept that smile to fade for any family.
Is this what we're willing to accept here in Iowa? Is this the level of help that we think is okay?
Sergei's parents, Larry and Mary, now join us. Thanks for being with us.
You're welcome.
Thanks for talking about this. Larry, can you explain to folks that there was care out there, it's just not the right kind of care that Sergei needed. So what was that like to go through?
Well, there is acute care, and we were able to get Sergei into acute care.
And that's the shorter term?
That's the shorter term. I'm guessing usually 6 to maybe 10 days in length. So we got him into that, but after a week or so, he was released, and we tried to use outpatient services. He failed that the first time and ended up back in acute care again. And having gone down that road, we knew that we had to try and find something more than outpatient services again. And so we were desperately searching across the country to find some place where he could go to get the care that he needed.
And you found some shorter-term solutions out of state that you tried. Eventually he came back home and then kind of succumbed to all of the troubles he had gone through. This is something that you had feared. You feared this day would come.
Well, I always feared that. We were working very hard to try and find places that could help him with any of the issues that he was trying to deal with. But we were always scared that the outcome could be a poor outcome for him and us.
Mary, you talked about that after this happened, people from all over our state started calling you and kind of considered you the expert and said, hey, what are we supposed to do?
Yeah, I heard from parents here in the Des Moines area called just sobbing, saying, you know, we need help for our children, we don't know where to go. I heard from a mom in Waterloo who was looking for mental health help for her teenage daughter, again, sobbing, desperate, didn't know where to turn. I certainly referred them to NAMI, the National Alliance on Mental Illness, gave them information about some of the places that we had investigated in our search for help for Sergei. But it just compounded everything that we were going through to know that there are other people out there who are right now facing the very same circumstances that we were facing. And from my perspective, that's just such an un-Iowan attitude. Like, we pride ourselves on taking care of people. We're Midwesterners, we're caring, we want people to have the help and support that they need. And in this area, I can tell you, we are not taking care of people.
I talked to people who, when you decided to go public after Sergei passed away, people came to me and talked to me about how can they do this? How can you do this part?
You know, I only have one Kleenex with me today, so I'm going to do my best to get through this. When Sergei was alive, we knew that he had a lot of baggage that came with him. There was no question about that. A child doesn't end up in a Russian orphanage if their life has been sunshine and roses. And so from the very beginning, we simply said to him, whatever it is, we're going to get through this. And I'm not going to be afraid of anything that comes along with you, because I love you and I love all of you, and it doesn't matter to me. And so I am carrying that attitude forward. I think I'm lying a little bit, because I'm scared to death. I'm scared that other people are going to be hurt just like we were hurt, and I'm scared that other people are going to end up without help just like Sergei did. But I feel like I have to try to make a difference, because if someone else were to be left in the situation that we were, and I hadn't tried to help, I could never live with myself.
Throughout this next hour, we're going to explore how mental health illness impacts families like Larry and Mary. We're all going to talk about schools, because as these kids are growing up, these schools are there, and often this falls on them to try to help. So we want to bring in our next guest here. Jason Vollmer is the coordinator at Urbandale Schools for Special Education. Jason, what are you experiencing? What is the strain on our school system right now?
You know, as you mentioned, all students with mental health concerns, and we see them K-12, are in our schools, and they come with a variety of concerns, and they have profound effects on their learning and the environment. Now, the good news is that we've got programs, and there's even better models coming out of integrated, comprehensive programs. The initiatives that we have, we can better integrate, we can expand, and we can better connect to the community resources. The hard thing is that, as Sergei's family mentioned, the community resources aren't what they used to be. And we find that students have less options, and when they get less quality care in the community, we certainly feel that in school, and we have to intensify our resources. Many of those students end up in special education with the most severe needs, and many of them are supported other ways. You know, another issue we have, these models that I talked about that are so wonderful, they're not disseminated to all schools. We really need leadership from the State Department of Education, and they've been really trying to give that. But recently, with the most recent budget cuts, I've really observed a difference in terms of their capacity to lead and disseminate that cutting-edge information. So we really feel those things.
So much of what we hear is the importance of helping these children as early as possible. So Dr. Amy Shriver, let's bring you in here. You're a pediatrician over at Blank. How vital is this, and what can we do to identify these kids while they're still young before it becomes even worse later on?
Yes, thank you for having me. And I do think that recognizing the importance of early identification is one of the reasons we're here. I want to say that I really admire your bravery for bringing this to the attention of the public, and for really highlighting it for our government to really understand why this is such an important issue. So yes, early identification. Children start with their brain development, and as soon as they're born, they're making 700 connections every second. They have a very plastic brain that has the potential for amazing growth and nurturing, but they're very, very vulnerable. And in those first 1,000 days, if they're experiencing a lot of stress, like Sergey likely did in his orphanage, it causes changes to the brain, and we now know that. So with that new knowledge of neuroscience, we can actually apply that to understand what appropriate treatments are needed to help support children and families. It turns out in Iowa, we have some excellent minds and we have some excellent coordination and cooperation of mental health, but we don't have an Iowa mental health system for children. We do have residential care facilities, but if I try and get one of my patients in there, it's going to be a long wait, and that's just not what our kids need. So we need to have a top-down approach, looking at what are the needs in Iowa, how can we get across systems to look at education and public health and the foster care system, and really work to integrate that starting at the very earliest ages.
So, thank you, Doctor. We've heard briefly about how mental illness impacts families, impacts schools, the importance of talking to these, identifying this early on. When we come back, we want to talk about the military. Ever since 9/11, we've seen Iowans go off to war. So we will talk to a veteran about what this strain puts on both the veterans and the families. And throughout this show, we hope you will share your experiences. Just use the hashtag #MentalState. We'll be right back. Welcome back to our town hall live from Des Moines at Iowa Methodist. We're talking about Iowa's mental health crisis. Curtis Gearhart, Richard Miles, both were Iowans, both served their country. Many feel, though, their country may have let them down after they returned. Both men survived tours in Iraq only to take their own lives once they returned to Iowa. Our next guest knows what it's like to go off to war. Dan Grinstead, thanks for making the trip from Iowa City. On a much lighter note, Dan makes us all realize how we need to work out more, because at the age of 57, he was in such great shape that the Iowa National Guard said, yeah, you can come right in.
That's right.
Come fight for your country.
They did.
I'm going to go work out as soon as we get done here. Thank you, sir. You know what it's like to go off to war. You went to Afghanistan. You're a social worker by trade. You can have pretty good insight about what you all bring back when you come back home.
Exactly.
Obviously,
right.
Unfortunately, we started this segment talking about a couple of young men who struggled back when they got here.
That's right. What families and general public don't know is it's hard to come home. The transition is the most difficult part.
So what do you need? All we hear about in the national news are about our Veterans Administration's hospitals struggling, the backlogs, and it's tough to get in there and it's tough to connect with the right kind of service. What is missing?
Well, let's start with talking about what's there, and then we can talk about what's missing. In Iowa, from General Orr on down through the chain of command, there's support for behavioral health. So there's a lot of prevention going on from the very beginning. Many people don't realize that part of our annual training is a suicide prevention talk where we learn how to recognize who in our brothers and sisters are in stress so that we can reach out to them and help them out. We're doing very well in the Guard for providing services, and one of the difficulties is when we go out for behavioral health services, say in the community, we're not sure that that community provider understands us. We think of ourselves as a culture. And because we're a culture, it's incumbent on that community provider to understand us. Now, some people may think, well, how could you possibly be a culture? How do you define a culture? Well, we have common values. We have common dress. We have a common language. I could talk to you in Millspeak and you would say, oh, I don't get that whatsoever. And so those are some of the things that we think are important for community providers to understand so they can work with us. For example,
So is it a centralized approach we need? Should you all just go to one big hospital in a state? I mean, what's the best way to deliver the services to your fellow veterans who need it?
well, I think one way is, of course, to use the services that are there through the VA, but let's reach out to the community providers and provide them with training on how to understand us better. I'll give you an example. There are some universities in the United States that require all their faculty to take a military culture course so they can understand us better.
And are you starting to see the progress?
I am. One of the things that I'm privileged to do is to go lecture throughout the state on college campuses and talk to college students about what they can do to understand us better, because there are lots of veterans in their classrooms.
Thank you, sir. Appreciate your insight, and thanks for your service.
Happy to do it. I'm ready to go back if they'd let me. I'm only 67.
And you're still in good shape, too. When we come back, obviously we know that this mental health crisis strains so many areas of our community. We're going to talk specifically about what it does to our prison system, our jails, and our hospitals. We'll talk about that when we come back. At home, feel free to join the conversation using the hashtag #MentalState.
We have found that a lot of people that we do take to the hospital because they really need to be there, they're spending days in the ER because there's no mental health bed for them to go to.
Iowans with mental health issues often fill our jail cells and our hospital beds. Let's look at some state numbers here. 57% of inmates suffer some kind of a mental illness. A third of them are considered seriously mental ill. So that's forced prisons into a temporary role of a mental health facility. Let's bring in our two doctors in this next segment. Dr. Stephen Mandler is the new Chief Medical Officer at Orchard Place. Thanks for being with us.
Thank you.
And Dr. Kevin Carroll is the VP of Behavioral Health here at Unity Point. Thanks for being here as well. Dr. Carroll, maybe you can start with this. Can you explain how this does tax hospitals, both yours and across the state, with folks who there's nowhere else to go?
Absolutely. Like the original story suggested, families get to a point where they need relief and need help and need assistance. And in so many communities, that one spot that's open 24/7 every day is the community hospital and the emergency department. And families turn to that resource for their medical care and for their behavioral health care.
So what do you say to somebody who say, hey, this is a hospital, why not just set aside a wing, and for those folks with mental illness, staff that up so it works in that wing, that specialized wing?
In many cases, and fortunately here in central Iowa, our hospitals have done that. Lutheran Hospital and Mercy and Broadlawns are all dedicated providers to behavioral health. There are logistical and financial operational reasons that make that very unrealistic or hard for some of our rural hospitals in the state of Iowa. Around workforce, psychiatry, it becomes a challenge.
Dr. Mandler, a person in the audience here from Johnson, Monica had asked, what about the effect that substance abuse plays into these folks, so that you're already having some kind of mental illness dealing with substance abuse on top? And of course, those are some of the folks that you all will see come in.
Yeah. Well, I think it's important to realize substances contribute greatly to the suffering that children and families go through. But it's not such a simple answer of saying adults stop using the drugs, because they themselves most likely didn't receive the kind of adequate mental health during their childhood. And so it's a cycle that perpetuates itself. And we have treatments and approaches that can really intervene early and interrupt this cycle. And we want to be able to do that.
But one of the things that you talk about is this problem with GOI, sort of our little slang for get over it, as you talk about.
Yeah. The Midwest, the agriculture work ethic is fantastic for getting work done. But when it comes to taking the time and sensitivity it needs to work through emotional issues, just getting over it, like just telling someone not to be anxious, is fairly useless. And so I think for the Midwest, we need to adapt and understand we can help people get over it, but through this kind of sensitive care that kids and families need.
Dr. Carroll, can you talk specifically about the ER? You know, in an emergency, obviously, that's a place we all rush. So for folks, especially those with the serious cases of mental illness, especially if there's been some other physical accident or whatever it may be, but law enforcement, family, whatever, they bring them in there. So what happens then once you get to the ER?
Yep. When a family comes in, whether it's with an adolescent or child or an adult, they're medically screened first to make sure that there's no medical issues. And then, again, fortunately here in Des Moines and any of the 3 emergency departments, they have a dedicated team that is specially trained, nurses or social workers, to evaluate, consult with psychiatrists, and make a disposition or a decision about what kind of treatment is best at that moment.
We're about a half a minute left, but then, okay, get outside of Des Moines. What happens when we start going to these smaller areas? How do they deal with this?
Frequently, it's long emergency department stays where those staffs are calling around the state looking for beds, looking for expertise, or dialing in with some sort of telehealth resource.
All right, doctor and doctor. Thank you, and thank you. Appreciate it. We've talked about beds here, right, throughout the hour so far. So when we come back, let's talk more about the beds. What do we have, and are they in the right places to get the people who need them to fill them? Also, if you're watching from home, we hope you will share in the conversation. Just use the hashtag #MentalState. We'll be right back. In Iowa, mental health and disability services, it's divided all into 14 regions in our state. Now, the goal is to provide community-based services that are locally available. Now, if you look at the map, though, the problem would be that 2 of the regions, from what we're looking at here, don't have a single psychiatric bed available, according to this. Statewide, we found 731 total beds, but that's if you count both public and private here. The state's numbers also show how often those beds would go empty. So on average, according to these numbers, you'd have at least 40 available beds statewide, but that doesn't necessarily tell the complete story. Let's bring in Peggy Huppert. She's the executive director of the Iowa chapter of NAMI, the National Alliance of Mental Illness. Thanks for being with us.
Thanks
All
for
right,
having
so
me.
you see the story about the beds. So we have beds, but they're not necessarily where we need them to be based on where the people are who need them.
Right. And the other problem is that they're not the right kind of beds. They're a lot of people who are not going to be accepted in any of them. So that's what you hear from law enforcement and from staff in emergency rooms who are desperately trying to find placements for people. People with complex needs who have perhaps a history of violence, aggression, substance abuse disorder, developmental disabilities. Any of those complicating factors can make it virtually impossible for them to find a bed.
So we saw that map with the 14 regions. In how many of those counties can you find what you need in that county? Or do you have to road trip in many cases?
Well, you have to road trip, and sometimes even if you're in Polk County, there's nothing available in Polk County. And so you have to go outside of Polk, which obviously is the biggest county with the most resources. But we don't always have what they need here either. So we also have a fair number of both adults and children having to go out of state. As Larry and Mary talked about, that happened with Sergey. It happens quite often. And the really unfortunate thing is that we're willing to pay whatever those providers are charging, sometimes up to $1,000 a day, but we have caps on what we'll pay our in-state providers. So that's a problem.
Okay, longer term here, what do we need? Is it just a matter of money? Is it spending money differently? What is it?
Well, we're definitely spending the money. We're spending it on jails and prisons and crime investigations. When people kill their family members, we're spending it on lost productivity. So I don't think we necessarily need to spend more money. We need to spend it in different ways. And we need to do more on prevention and help in the community. Beds is not the only answer.
So much of our state is rural here. So, we have population centers where we have a lot of people, but, 2/3 of our state is shrinking. Mm-hmm. So we have a lot of rural areas. How do we get a provider? Is it realistic to have one in each of our 99 counties?
It probably isn't, but there are other solutions. Telehealth is part of the solution. We've talked about access centers where there's 24/7 secure access with where law enforcement can access that help. There's crisis intervention teams. If we had those trained covering all 99 counties, that's part of the solution. We know pretty much from what other states are doing what works. We just have to have the political will and people working together to bring it here to Iowa.
From a practical matter, do we need to put more money up front and then eventually it's going to save relieving the burden on hospitals, prison systems, schools,
exactly right. We need some more money up front, and we need more coordination and accountability across the board. It used to be 99 counties, now it's 14 regions, which is certainly an improvement, but there still needs to be more collaboration and direction from the state, we think.
And you have a conference Friday to address some of these
we do.
issues.
www.namiiowa.org. We're going to have a lot of great speakers and a lot of opportunity to learn and network. So I encourage everyone to go and consider joining us on Friday.
All right. Thank you much.
Thank you.
All right. Now it's up to the decision makers, right? So they're up next. We'll talk to them about what they've heard so far today. Have they heard anything that can possibly work? And their own ideas. We hope you'll share your ideas from home. Just use the hashtag mental state. More of your thoughts and our experts when we come back.
I'm willing to do what we're doing every single day, and that's continue to look at the system and to never be satisfied with the status quo. I mean, you know, I'm a mom and a grandma. I can't imagine losing a child or dealing with just some of the issues that Iowans are dealing with that have mental health challenges. And so I have a lot of confidence in Director Foxhoven. I brought him in because I want him to take a look at the system. I want him to help us find areas where we can better serve vulnerable Iowans.
That was Governor Reynolds several weeks ago, kind of an emotional moment when she was talking to Kathy Obradovich from the Des Moines Register, and they were talking about what happened with Sergei Neubauer. This was just right after that. We heard Marion Larry share Sergei's story earlier this hour, and the governor revealed that she too has a relative who has dealt with mental illness. So now she is responsible for improving our mental health system in the state. And so are these folks. So let's bring in our next guest. Mark Smith is the House Minority Leader for Marshalltown. Thanks for being here, sir.
Thank you. Nice.
And social work is in your background, so you
Yes.
deal with a lot of this. Bob Brownell is the Republican Polk County Board of Supervisors. Thank you, sir. All right, so we have the county, we have the state, we have Democrat, we have Republican. Supervisor Brownell, you've done some things in your career, like essentially going undercover at the old YMCA downtown to try to get an inside look about, frankly, mental illness, alcoholism, and exposed you to all kinds of things. What kind of specific needs on a county-wide level are you seeing?
Well, we see the same things that we see across the state. I mean, Peggy mentioned that Polk County is the largest county, so we get all the good things that happen, we get all the bad things, and one of those bad things is an uptick in mental health issues, substance abuse issues, crime, jail populations, and the sort. The problem that we have, one of the problems with this issue is you take one step into it and you're in the weeds. It's a very difficult, very complex issue, and so talking to people about it is difficult because their eyes tend to glaze over because it's very complicated. Having said that, I would say that everybody knows Marion Larry. They might know him by a different face, they might know him by a different name, they might know him by different sizes and different neighborhoods, but we all know somebody who knows somebody, a relative or a friend or somebody in school that's been touched by this. And so it's important that we do understand it because it's a way that when we do understand it, I think we'll see the wisdom in providing more beds. And that is the key, is the beds. You talked about it in the last segment.
And that comes down to money, though, right?
That comes down to money. You're absolutely right.
All we hear about is a tough budget coming up. So how does that happen?
Well, we've got a couple ideas, and it involves giving the county a little more power over the mental health issues. And I realize not every county is Polk County. I mean, I totally get that. But my check gets signed by Polk County, so that's what I'm worried about. And that's an area where I think we can do some good. You know, I think the Marion Larry story is replicated every day here. And what that is they go looking for inpatient treatment, and they have a judge say, yeah, we agree, we're going to put this guy in inpatient treatment. And he's supposed to be evaluated in 5 days. They evaluate him, say, yes, he belongs in here, shouldn't get out. So we need inpatient treatment, but there are no beds. And so we default to outpatient treatment, and that's where the problems begin. And that's exactly what happened to them and what happens to people every single day across Iowa.
Leader Smith, you see this on a statewide basis, and if I may, I'm going to borrow a question from the audience that Nancy Bobo offered, and she brings up how there are just too few child psychologists. Another thing comes down to money here. Yes. What do you see as a legislative priority going into January's session? And you're in the minority, so you need the majority to go with you.
Right. Yes. I think that she hits on a very important point, and you said psychologists. I think psychiatrists, that we have very few child psychiatry people here in the state. This is coming at a time when the knowledge about mental illnesses, the onset, course, and duration of mental illnesses is at an all-time high, and yet we have this low level of professionals who are providing the services. Not the quality when they're here, but the number that we have in our state. So this issue is not an issue that is easily addressed without addressing the money part of this. And getting treatment to Iowans requires us to, first of all, put more money in the training of all the mental health professionals, psychiatrists, psychologists, social workers, nurse practitioners, counselors, the whole area, plus expanding those services. That we've seen a great deal of growth in people with mental illnesses, helping people who also have mental illnesses. One of the reasons that I always promoted doing group therapy is that oftentimes people who have a mental illness can identify decompensation before we can as professionals. That's the first step. The second step then is to equalize funding across the state so that we have more availability of services in some of rural Iowa that we currently don't have.
Let's bring in the new director of the Department of Human Services, Jerry Foxhoven. Just started in June, and now it's his responsibility as this statewide department moves forward here to try to figure out, okay, what's next? Director Foxhoven, thanks for being with us. I know you changed some schedule here late in the day so you could come over here.
Thanks, Dave.
What have you heard throughout this hour that's a practical takeaway here, and what's the state already doing?
Well, we're doing a lot, and one of the things I think is really important to understand, it isn't just number of beds. And when Peggy Huppert talked about, it's that acuity level, which is really, really essential. That we don't have the high acuity level, we don't have enough of those kind of beds. Total number of beds, we may have the right number. Secondly, we have people sitting in beds that shouldn't belong in those beds because, as you heard Larry and Mary say, they moved down from, they were an inpatient and then they went to outpatient. There are things in between that we should have been offering, and those are subacute care. And if we develop good subacute care, we'll move people out of those beds, open them up, so that people who really need the bed get it. It's better for the patient, it's better for the next patient who needs a bed, and it's better for the whole system. It's cheaper as well.
I understand your boss may be watching here, so if the governor is watching in her travels, do you need more money?
Well, you know what? I'd always say we always need more money. The question is, is there enough money?
What's the ballpark? Give a percentage increase. What do you need? What do you want?
There will never be enough money to properly provide the mental health services. That's not true only in Iowa. It's true all over the country. Because, you know, people will say to me, are you satisfied with where we are? No, I'm not. But I'll never be satisfied if we have one person, if Larry and Mary, one couple like that, have a child or have a relative who doesn't get absolutely everything they need, we shouldn't be satisfied. So I don't know that we'll ever be satisfied. It's getting the right mix of all the full array of services. We also, the other thing that's really missing is the co-occurring treatment. In their particular case, when you have a combination of substance abuse and mental health, we don't have enough treatment modalities for that in Iowa. There's no question about it. There's something really missing there, and we need to develop that. Now, I think the move to the regions was a good move, and I think the state's first primary obligation right now is to meet with those regions, get together with the regions, assess in their regions what are the gaps that are there and what's there and what's missing, and how do we fill what's missing, what it'll cost and who's going to pay for it.
You're already dealing with about a half a minute left. Aren't you already dealing overall, your entire department dealing with fewer dollars than the year before?
Sure we are, you know, and all the state government is, and everybody is. And so that's why I really credit Larry and Mary for coming up and stepping up, because at some point we have to say what's our priorities, and nobody's going to be able to just print more money, so you're going to have to decide between one thing and another. And it's important for us to have this conversation to say this is a priority in Iowa. We need to provide more mental health services, more comprehensive array of services.
All right, Director, thank you much. And point out the Director will be part of Peggy's conference at NAMI at the end of the week as well. When we come back, final request from Larry and Mary. And back home, if you'll continue the conversation, just use the hashtag mental state. We'll be right back. Thanks for being part of our hour-long focus on Iowa's mental health system. We thought we would spend our next couple of minutes bringing back Mary and Larry about all the things you have heard since this all really started with you as you decided to go public and share Sergey's story. Larry, one of the things you had talked about when we had you on the Insiders one Sunday morning was the importance of not being afraid to seek help if you need it.
And that's true. Sergey did ask us for help from time to time, but I know he felt that in doing so he was maybe being weak. The reality is you have to be strong to ask for help. So I would beg people out there that if you need help, don't feel like you're being weak by asking for it. You're being strong. Be strong and ask for it if you need help.
Mary, at Sergey's service, you had hundreds and hundreds and hundreds of people. It was very difficult to find a parking spot that day. So many of Sergey's classmates came, and almost everyone had some story to share about Sergey. What have your conversations been like with his friends?
You know, two of his friends are here in the audience with us today. He was a kid who had impact. You didn't just meet Sergey. He was a force of nature. He was outgoing and happy, and woe to the person who took him on wrestling or on the rugby field. He was artistic. He could just sit down and draw whatever it was. But more than that, kid after kid, and when I say kid, I should say young person in line, said to us, Sergey looked out for us. Sergey made sure I wasn't alone. If I was having a bad day, Sergey came over to me. Sergey made sure other people didn't pick on me. He was a protector, and I'm so sorry that that's not here for all those people who needed that little help in their life.
When you went to that orphanage in Russia a few years back, you watched the way he interacted. So what would he always had that heart to want to help others. What would he think about all of this and just having this conversation?
You know, I wonder, I know he is up there watching us, and I wonder if he's a little mad at us for telling his story, because Sergey always wanted to be the strong one. He didn't want people to know that he was struggling. It will stick with me to my dying day. There was a tiny little boy in the orphanage. His name was Misha. And he was Sergey's age, but he was so much smaller than Sergey, and Sergey told us later that he looked out for Misha and took care of Misha. He would be amazed that this conversation is going on. He would, I think, say, really? All these people cared about me, cared about this story that I was involved with? And so for other people out there who are struggling, and for other people who recognize Sergey's story because Sergey's story is their story, yes, people do care. And you can have an impact if you speak up and if you say, I'm struggling, because it helps other people know they're not alone, and that they can identify with you and hopefully find help for themselves as well.
Thanks to both of you for sharing Sergey's story and for sparking all of this. Thanks to Iowa Methodist for the facility, for Orchard Place, for Urbandale Schools, for Director Foxhoven, and our elected officials. Thanks to all of you at home who've contributed to our conversation at #MentalState. We will continue our conversation on the Channel 13 Facebook page. The Channel 13 News at 5 is up now.